25. Linctisers. Linctisers are viscous, sweet, liquid, oral preparations that are usually prescribed for the relief of cold. They consist of simple solutions or admixtures containing a high proportion of syrup and sometimes glycerin, which in addition to giving sweet taste to the preparation, have a demulcent action on the mucous membranes of the throat. For best results, linctisers should be used without dilution and sipped and swallowed slowly to ensure prolonged contact with the mucous membranes of the throat. E.g., codeine linctus, tolu compound linctus, etc. 26. Liniments. Liniments are liquid or semi-liquid preparations meant for application to unbroken skin by friction, or applied on lint or other suitable material and placed on the affected part. They may be alcoholic or oily or soapy solutions or emulsions. Alcoholic liniments are used generally for their rubefacient, counterirritant, mildly astringent, and penetrating effects. The oily or soapy liniments are milder in their action but are more useful when massage is required. Liniments should never be applied to skin areas that are broken or bruised, e.g. camphor liniment, turpentine liniment, compound calamine liniment, etc. 27. Lotions. Lotions are liquid or semi-liquid preparations meant for application to unbroken skin without friction. They are either dabbed on the skin or applied on a suitable dressing and covered with waterproof material to reduce evaporation. An evaporating vehicle like alcohol may be used when a cooling effect is desired on application to the skin. Lotions generally contain antiseptics, astringents, anesthetics, germicides, protectives, or screening agents for prevention or treatment of various skin diseases, e.g., calamine lotion, white lotion, hydrocortisone lotion, etc. 28. Lozenges. Lozenges, also known as troches, are solid oral dosage forms containing medicaments in a sweetened and flavored base, intended to dissolve slowly in the mouth. The base may be a hard sugar candy, glycerinated gelatin, or a combination of sugar with sufficient gum to give it form. Lozenges do not disintegrate in the mouth but dissolve slowly, liberating the active ingredient, which may be an antiseptic, local anesthetic, antibiotic, antihistaminic, antitussive, analgesic, or a decongestant, e.g., licorice lozenges, hydrocortisone lozenges, amphotericin lozenges, etc. 29. Mixtures. Mixtures are oral liquids containing one or more active ingredients dissolved, suspended or dispersed in a suitable vehicle. The vehicle is usually aqueous. The insoluble substances in the mixture do not make it very viscous. These may settle slowly on standing but easily redisperse on shaking. The term was originally applied to liquid preparations which were prepared freshly and used fairly quickly, e.g., within a month. Frequently, the term mixture is applied loosely to aqueous preparations of every description. Examples include kaolin mixture, ferric ammonium citrate mixture, cough mixture, etc. 30. Mouthwashes. Mouthwashes are aqueous solutions containing one or more active ingredients for use in contact with the mucous membranes of the oral cavity, usually after dilution with warm water. They may contain additives such as alcohol, glycerin, synthetic sweeteners, surfactants, flavoring and coloring agents. Mouthwashes are most often used for their cleansing, deodorizing, refreshing or antiseptic action. They may be either acidic or basic in their reaction, and, in some instances, are fairly effective in reducing bacterial concentration and odors in the mouth for short periods of time, e.g. compound sodium chloride mouthwash, zinc fluoride mouthwash, compound sodium borate mouthwash, etc. 31. Nasal drops. Nasal drops are solutions, suspensions or emulsions containing active ingredients, intended for installation into the nostrils, usually with the help of a dropper. Nasal drops are mostly based on aqueous vehicles, although oily drops, containing liquid paraffin of suitable viscosity, are not uncommon. Oily vehicles are generally not preferred since the oil may retard the ciliary action of the mucosa and may even cause lipoid pneumonia if drops of the oil enter the lungs. Nasal drops are generally formulated to resemble the nasal secretions as closely as possible. Thus, these are usually isotonic and slightly buffered to maintain a pH of 5.5 to 7.5. Additionally, the viscosity of the preparation does not exceed that of the mucosa. Commercial nasal preparations usually contain decongestants, antibiotics, antihistamines and drugs for asthma prophylaxis, e.g., ephedrine nasal drops, phenylephrine nasal drops, etc. 32. Nasal sprays. Nasal sprays are suspension or solution of drugs intended for spraying into the nostrils. The chief uses of nasal sprays are to relieve nasal congestion and inflammation and to treat infections. As the nasal sprays are intended to be retained in the nasal tract, they are usually viscous and coarse since fine droplets tend to penetrate further into the respiratory tract. These preparations are usually supplied in pressurized containers or plastic squeeze bottles. 33. Nasal powders. Nasal powders are powders intended for insufflation into the nostrils by means of a suitable device. The size of the particles should be such as to localize their deposition in the nostrils. 34. Nasal washes. Nasal washes are generally aqueous solutions intended for irrigation of the nostrils. Nasal washes intended for application to injured parts or prior to a surgical operation are sterile. 35. Ointments. Ointments are semi-solid preparations that are intended to be applied to the skin or certain mucous membranes for emollient, protective, therapeutic or prophylactic purposes where a degree of occlusion is desired. Ointments are generally formulated to provide preparations that are immiscible, miscible or emulsifiable with the skin secretions. Ointments usually exhibit plastic flow characteristics and hence when these are applied there is a definite yield value. The resistance to flow however drops as the application is continued, e.g., betamethasone ointment, methyl salicylate ointment, povidone-iodine ointment, etc. I. Hydrophobic ointments. Hydrophobic, lipophilic ointments can absorb only small amounts of water. Typical substances used for their formulation are hard, soft and liquid paraffins, vegetable oils, animal fats, synthetic glycerides and waxes. E. Water emulsifying ointments. Water emulsifying ointments can absorb larger amounts of water. Their bases are those of hydrophobic ointments and in them are incorporated water in oil emulsifying agents such as wool fat, wool alcohols, sorbitol esters, monoglycerides and fatty alcohols. E. Hydrophilic ointments. Hydrophilic ointments are preparations having bases that are miscible with water. The bases mainly consist of mixtures of liquid and solid polyethylene glycols. They may contain appropriate amounts of water. 36. Pediatric drops. Pediatric drops are oral liquids intended to be administered in small volumes to babies and infants with the aid of a suitable measuring device. Usually the dose of medicaments prescribed to children is quite small and due to stability reasons these cannot be formulated in a dilute form. The medicaments are then formulated as concentrated solutions and supplied in bottles or other suitable containers along with an accurately calibrated dropper to measure or to withdraw the accurate dose. Examples of medicaments available as pediatric drops include paracetamol, ampicillin, erythromycin, etc. 37. Parenteral preparations. Parenteral preparations are sterile products intended for administration by injection, infusion or implantation into the body. There are 5 main forms of these preparations, namely injections, intravenous infusions, concentrated solutions for injection, powders for injection and implants. I. Injections. Injections are sterile solutions, emulsions or suspensions. They are prepared by dissolving, emulsifying or suspending the active ingredient and any additives in water for injection or in a suitable non-aqueous vehicle, or in a mixture of the two. Intravenous infusions. Intravenous infusions are sterile aqueous solutions or emulsions with water as the continuous phase. They are free from pyrogens and are usually made isotonic with blood. Intravenous infusions are principally intended for administration in large volume. They do not contain any added antimicrobial preservatives. Concentrated solutions for injection. Concentrated solutions for injection are sterile solutions that are intended to be administered by injection or by intravenous infusion only after dilution with a suitable liquid. 38. Paints. Paints are solutions or dispersions of one or more active ingredients, intended for application to the skin or mucosa of mouth and throat, usually with the help of a soft brush or a cotton swab. Skin paints often have a volatile solvent such as alcohol that evaporates quickly to leave a dry or resinous film of medicament. Throat paints are generally more viscous due to a high content of glycerin which, being sticky, adheres to the affected area and prolongs the contact time and hence action of the medicament. Examples of paints include compound paint of iodine, also known as Mundell's paint, crystal violet paint, etc. 39. Pastes. Pastes are semi-solid preparations for topical application that differ from similar products in containing a higher proportion of finely powdered medicaments. Due to high concentration of powdered ingredients, pastes are thick and stiff and form a protective layer at the site of application. They are reasonably absorptive and hence are often used in the treatment of oozing lesions where they act to absorb serous secretions. Pastes are usually intended to be applied to small, localized areas of the skin and are not suitable for application to hairy parts like scalps because they form a densely matted mass, e.g., zinc oxide paste, coal tar paste, magnesium sulfate paste, titanium dioxide paste, etc. 40. Pastiles. Pastiles are solid medicated preparations intended to dissolve slowly in the mouth similar to torches and lozenges, the main difference being that pastiles are comparatively softer. These generally consist of a basis of glycerol and gelatin containing the medicament in solution or suspension. Acacia and sugar are also sometimes used when hard pastiles are desired, e.g., squill pastiles, menthol and eucalyptus pastiles, etc. 41. Pessaries. Pessaries are solid dosage forms meant for introduction into the vagina, where they melt or dissolve and exert a local action. Pessaries are prepared either by molding or by compression. Molded pessaries are usually cone-shaped and prepared in a manner similar to suppositories and hence are also known as vaginal suppositories. Compressed suppositories, prepared by compression, are available in a variety of shapes and sizes and are also known as vaginal tablets, e.g., pessaries of clotrimazole, nystatin, ikthamal, etc. 42. Pills. Pills are small, round solid dosage forms containing one or more active ingredients, meant for oral administration. Pills were formerly the most extensively used oral dosage form, but they have been largely replaced by compressed tablets and capsules, e.g., phenolphthalein pills, hexylzosanol pills, etc. 43. Poultices. Poultices or cataplasms represent an ancient class of semi-solid preparation meant for external use. These consist of soft paste-like mass obtained from meal, herbs, seeds, etc. For application, the hot preparation is spread thickly on a dressing and applied to the affected area as hot as the patient can bear. Poultices were mainly used as counter-irritant because of their heat-retaining property. Example of a poultice preparation includes kaolin poultice. 44. Powders. Powders are preparations consisting of solid, loose, dry particles of varying degrees of fineness that contain one or more active ingredients with or without auxiliary substances like sweetening, coloring and flavoring agents. Several categories of powders can be distinguished based on their intended use. Powders for oral use. Powders for oral administration generally consist of powder dosage forms intended to be swallowed directly or in or with water or another suitable liquid. These are packed either in single-dose containers like sachet, paper packet and vial or in multi-dose containers provided with a measuring device. Effervescent oral powders generally consist of acid substances along with carbonates or bicarbonates that react rapidly in presence of water. These may also be packed either in single-dose or multi-dose containers and are meant to be dissolved or dispersed in water before administration. Powders for liquids for oral use. Powders for the preparation of oral liquids are intended for the preparation of solution or suspension for oral use. Such preparations are used for drugs like antibiotics, which are unstable in the presence of water and hence cannot be presented in a liquid dosage form. In addition to sweetening, flavoring and coloring agents, these powders also contain suitable dispersing or suspending agents. The powders are generally meant to be used within a short period of time after reconstitution. Powders for injections. Powders for injections are sterile, solid substances, including freeze-dried materials, packed in their final containers and which, when shaken with the prescribed volume of the appropriate sterile liquid, rapidly form clear and practically particle-free solutions or uniform suspensions. Such preparations are used for drugs like antibiotics, which are unstable in the presence of water and hence cannot be presented in the form of a liquid injection. Powders for topical use. Powders for topical use consist of powders in a very fine state of subdivision and are meant for external application to the skin. Powders for topical use are generally of two types. Dusting powders. Dusting powders are very fine, free-flowing powders meant for application to unbroken skin. These are employed chiefly as lubricants, protectives, antiseptics, antipyretics, astringents, absorbents and antiperspirants. These are generally dispensed or marketed in sifter top or pressurized containers. Surgical powders. These consist of sterile powders intended to be used on large open wounds or on severely damaged skin. They differ from other dusting powders in that they are sterile. 45. Solutions. A solution is a homogeneous mixture prepared by dissolving a solid, liquid or gas in another liquid and represents a group of preparations in which the solute or dissolved substances are dispersed among those of the solvent. Solution dosage forms include solutions for internal, external as well as parenteral administration. Solutions are also used for irrigation purposes and for administration into body cavities. Solutions for parenteral administration are sterile. Dextrose solution, Ringer solution, etc. 46. Spirits. Spirits are alcoholic or hydroalcoholic solutions of one or more volatile substances. These preparations are generally used internally for their medicinal value or as flavoring agents. Examples include aromatic ammonia spirit and chloroform spirit. 47. Sprays. Sprays are liquid preparations of the drugs intended for spraying to the skin or mucosal surfaces like that of nose and throat. These are prepared by dissolving or dispersing drug substances in a suitable aqueous or alcoholic vehicle and containing auxiliary substances like humectants and polymers. Sprays are usually presented in pressurized containers. 48. Suppositories. Suppositories are medicated solid dosage forms of various shapes and sizes meant for insertion into the rectum, vagina, urethra or other body cavities other than mouth, where they melt, dissolve or disperse and exert a local or sometimes a systemic effect. Suppositories for vagina and urethra are also known as pessaries and urethral buggies respectively. Molded suppositories are usually prepared by pouring the medicated mass, sufficiently liquefied by heating, into molds of suitable volume where they solidify. Alternatively, the solid medicated mass may be cold molded by compression in a suitable matrix. Various bases such as theobromine oil, hard fat, polyethylene glycol are suitable for the preparation of suppositories. 49. Syrups. Syrups are concentrated solutions of a sugar such as sucrose in water or other aqueous liquid. In addition to sucrose, suitable polyhydric alcohols such as glycerin and sorbitol may be added to retard the crystallization of sucrose or to increase the solubility of added ingredients. When purified water alone is used for the preparation of the solution of sucrose, The preparation is known as a simple syrup. Syrups usually contain aromatic or other flavoring agents. These generally do not contain any active ingredient, but if a medicinal substance is present, then these are referred to as medicated syrups. 50. Tablets. Tablets are solid pharmaceutical dosage forms containing a single dose of one or more active ingredients with or without auxiliary substances and prepared either by compression or molding methods. They are intended for oral administration. Some tablets are swallowed whole, some after being chewed, some are dissolved or dispersed in water before administration, and some are retained in the mouth where the active ingredients are liberated. The auxiliary substances used for the preparation of tablets include diluents, binders, disintegrants, gluttons, lubricants, etc. 51. Tinctures. Tinctures are alcoholic or hydroalcoholic solutions prepared from vegetable materials or from chemical substances. Traditionally, tinctures of potent vegetable drugs have been obtained either by using 1 part of drug and 10 parts of extraction solvent or 1 part of drug and 5 parts of extraction solvent. Tincture are usually clear, but a slight sediment may be produced on standing. Examples of tinctures include compound benzoin tincture, iodine tincture, etc. Metrology. Metrology may be defined as the study of the various systems of weight and measures, their relationship and the mathematical principles involved in their interconversion. 2 systems of weight and measures have been used in medicine and pharmacy. 1. The imperial system. 2. The metric system. The imperial system of weights and measurement is an old system and has largely been replaced by the metric system in India. The imperial systems includes 2 systems for weights and measurement. A. Avoirdupois system. B. Apothecaries. Measurement of weight. In avoirdupois system, the pound, lb, is the standard unit for weighing and all measures of weight are derived from it as follows. 1 pound equals 16 ounces, avoir. 11b equals 7,000 grains. Laws equals 437.5 grain. In the apothecaries system, the grain is standard unit of weight and all other weights are derived from it. 20 grains equals 1 scruple. 60 grains equals 1 dram. 480 grains equals 1 ounce, apother. 8 drams equals 1 ounce. 12 ounces equals 1 pound, lb, apother. 5,760 grains equals 1 pound, apother.